I'm Dr. Lisa Palmer, Dr. Mama Bear, head physician at Palmer Natural Health, located in Central Florida. We are a holistic quantum nutrition, chiropractic massage, and educational company located in Longwood, Central Florida. Longwood's a suburb of Orlando, and we're happy to serve patients in our local area and clients from all over the world. Tonight's topic is navigating female health, hot flashes, PMS, PCOS. What is the deal with that? And how do we handle that? What are natural solutions for women? So if you guys are out there, definitely say hello in the chat. Happy to answer any of your questions on any health related question. It could be a female question on whatever. I'm happy to hang out with you guys tonight. So what the heck is up with hot flashes? What is up with PMS? So I guess we'll start with PMS. Since usually it happens before hot flashes, PMS stands for premenstrual syndrome. Now I'll ask you, are syndromes normal? So if you encounter a person with Down syndrome, is that a normal condition? If you encounter someone with a other type of syndrome, is a syndrome normal? So I want to say some shout outs. Hi, Janice. Hi, Michelle. Glad you guys are out there. Thank you for joining us tonight. So typically people would consider syndromes not normal. So if something's labeled premenstrual syndrome, do you think you should have that? Do you think that is normal? There is a difference between normal and common. In our society, PMS is common, right? So, what would you consider PMS symptoms? Becoming emotional during your period. Your husband or boyfriend might have other terms for it. What about tender breasts, bloating, cramping, diarrhea? Some women experience diarrhea. What are other PMS symptoms? Hi, Robin. Hi, Jonathan. Hi, Kate, all the way from Canada. Janice says crabby. So, maybe a woman with PMS is crabby, emotional, overreactive, right? These are all signs that something is imbalanced in the body. As we get older, you have your menstrual cycle, which all menses is the shedding of the endometrium, the shedding of the wall of the uterus. It does not mean symptoms. As we get older, you go through menopause. Menopause means pausing of menses. Menopause does not mean hot flashes. It does not mean low libido. It does not mean dryness. It does not mean low hormones. It just means your period stops. Menstrual cycle stops, right? That's all that means. It doesn't mean any of those other symptoms. Those symptoms, whether it is premenstrual syndrome or menopausal symptoms, those symptoms mean there's imbalances in your body. Now, what does the medical world do with symptoms, right? Especially PMS or hot flashes. What is the treatment standardly in medicine? Well, medicine looks to suppress the symptoms. Medicine looks to bypass the body. And so I'm not bashing any medical doctors. I have friends that are medical doctors. I have friends that are naturopaths. I have friends that are doctors of osteopath, but the mindset's different. So in quantum nutrition, which is what we do at Palmer Natural Health, we look for the cause. We look for, why did the person start to have PMS? Why did the mom start to have hot flashes where she's sweating through her pajamas and sweating through her clothing and she's like just dripping sweat? Why did that occur? What was the cause? We look for the cause. Well, what would imbalance hormones? So the medical treatment, if you have imbalanced hormones, they give you hormones. Okay, well, if you give your body hormones, what happens? It's called a negative feedback loop. You'll actually make less hormones. If you give a guy testosterone, he's going to have less production of testosterone himself. And in some cases, the testicles will shrink. Some men that inject steroids, that's one of the side effects of steroids is their testicles shrink. They become aggressive. They break out in acne. It's harder on the heart. Every time you take a hormone, whether it's estrogen, progesterone, estradiol, bioidentical, those are all hormones. Those are all chemicals that do not belong in your body. Now, I am not saying not to take your hormones. I am not saying stop your estrogen. I'm not saying stop your progesterone. I am not saying stop your testosterone. I did not prescribe that for you. So I am, just to make it clear, I'm not saying to stop that, right? Because if you stop a synthetic hormone abruptly, you will experience a negative effect. So I've had women, they didn't want to take progesterone anymore. They stopped it and then they became very emotional. I've had men stop testosterone and then they became very emotional. I've had women have 10 times the amount of testosterone because they were given a synthetic testosterone by their doctor. So they had better drive, right? And so one of my patients, she was taking testosterone before I met her, and she did that for drive. And all of a sudden, she started getting very aggressive. And she's a very sweet lady. She told me, "Yeah, Dr. Palmer, I just want to punch this lady in her face." And I was like, "Wow." And she goes, "Yeah." And then in traffic, I wanted to like hit somebody with my car. I'm like, "Oh my gosh." And I said, "Well, you're sounding really aggressive. What's going on with you?" She had blood work. We found out her testosterone levels were 10 times higher than normal. Okay. So all medications, whether they're hormones, whether they are blood pressure medicine, whether they are cholesterol medications, whether they are inhalers, steroid, whatever the medication, it always comes with a side effect. And the side effect is a negative effect. What do you do? How do you handle? But Dr. Palmer, I have horrible PMS. I have horrible migraines. I have horrible cramps. I have horrible bleeding. I have clots. I have hot flashes. I have so what do you do when someone has symptoms, right? How do you handle it? So Kate says Midol, right? So some women take Midol. Will Midol ever fix the cause of your cramps? Will Midol ever fix the cause of your PMS? Will Midol ever fix it? No. It may suppress the symptom, but it'll never address or handle the cause. In holistic healthcare and quantum nutrition testing, we're looking for the cause. So perhaps one of the causes can be liver toxicity. What is liver toxicity? Well, your liver is a big filter, right? And that liver will filter out chemicals in your water. It will filter out chemicals in the air. Well, where the heck do chemicals in the air come from? It can come from things that are sprayed in your environment, like aerosols. There's some hotel chains that as soon as you walk into the lobby, they spray automatically so the hotel smells good. Some people put plugins in their wall. Some people burn candles. Some people spray chemicals in the air so you can inhale the chemicals. The chemicals also can come from exhaust from cars and trucks, can come from other things that are sprayed in the sky. And so these chemicals can off gas off your bed, off your walls, off your furniture. We live in an extremely toxic environment. Your liver is working overtime to try to filter out those chemicals from the air we breathe, the water we drink, the food we eat, right? And off of the furniture, off the carpet, off of the new car smell, right? All those are a chemical load. And when the liver gets overworked, maybe you get angry, right? So in Chinese medicine, a toxic liver, the emotion can be anger. When the liver gets overworked or clogged, you will not break down hormones properly. Therefore, too much estrogen can accumulate in your body. When you have too much estrogen, that can lead down the road of cancer, breast cancer, cervical cancer, ovarian cancer, when there's too much estrogen in the body. Male bodies have estrogen, female bodies have estrogen. Male bodies have testosterone, female bodies have testosterone. And so a male with excess estrogen will become more feminine. They'll grow increased breast tissue. They may become more apathetic. They become more, okay, well, that's fine with me. I don't care. So if you're running into a male that might be more apathetic, they may have high levels of estrogen. If you're running into a female who's very aggressive, they might have high levels of testosterone. You don't want to have high levels of each. That clogged up liver is supposed to break down hormones. That clogged up liver, your liver, if it works properly, is supposed to process toxins. If it cannot, if it's clogged up, you're going to have excess estrogen. You might have excess testosterone. What does that look like? That will look like PMS symptoms. You might get really bloated. You might get, when someone mentioned they get gassy. You might be super emotional. You might have breast tenderness. You might have a really heavy cycle. So instead of doing a total hysterectomy because you have a heavy cycle, and removal, a total hysterectomy is removal of the uterus and the ovaries. Sometimes they keep the ovaries, but everything's connected. So if you take the uterus out, the fallopian tubes and ovaries, the structure gets changed. If you take the uterus out, the bladder is negatively affected. And so I run into women who they had hormonal issues because perhaps they had a toxic liver. They were having heavy periods. They were hemorrhaging or bleeding a lot. And so the doc said, okay, well, you're bleeding too much. You're not going to have any more babies. So we'll just take that out. Well, when you take out the uterus, it has a negative effect. The structure of the bladder doesn't have the support system because an organ's missing. The ovaries don't have a support system because the uterus is missing, right? And so when that occurs, sorry, something's bothering my eye. When that occurs, the body won't function properly. So in some cases, the bladder will prolapse or fall. In some cases, the vagina will prolapse or fall. And so then what they want to do is they want to tack up with staples. They want to staple those organs back together, or they want to put devices in there to keep those organs up. Well, why did the organs fall? The organs fell because the support structure that they were all working together was removed. That's like taking a wall off your house and expecting your house to stand up, expecting your house to function properly, right? So when you compare healthcare to another industry, it sounds insane. I was talking to a IT professional. His expertise is computers and networks. And so I said, okay, well, your symptom is like this. If someone comes to you and says, hey, my computer's not working. I have this error message going on. And you said to the person, well, just don't click on the error message. Just ignore the error message. What would they think about you as an IT professional? And his response was like, well, they would think that I'm a horrible professional, right? Like I'm ignoring the problem. And I said, yeah, you're right. And I said, and what if, that this error message box came up on their screen and they called you to fix it. And then they put a piece of paper over your screen, maybe a Post-it note or a piece of computer paper, right? And they said, okay, well, we don't know the cause of the error message. So what we're going to do is we're just going to put a Post-it note over the error message and you just won't see it anymore. Or just don't click on it, right? Like if they say, if your shoulder hurts when you do this and the doctor says, well, don't do that. Is that a good solution? No, they're not finding the cause. If the error message pops up on your computer screen and your IT professional says, yeah, let's just cover that with paper, that would be very similar to you have a symptom. So say it's PMS and your doc says, okay, well, let's just take these hormones and we'll cover it up. They never found out why you were having the symptom. If you have a headache and you don't find out why, you just take, Excedrin migraine to cover up the pain, but you never found out the cause. Maybe you were dehydrated. Maybe you were sleep deprived. Maybe your hormones were messed up and it was a hormonal headache. Maybe you had sinus pressure. Maybe you were hungry. Maybe you normally drink coffee and you stopped drinking coffee abruptly and you had a caffeine headache. Maybe you're withdrawing from something, right? So every single symptom in the body has a cause. And with quantum nutrition testing, we look to rebalance the body naturally with herbs, naturally with carbon-based technology, naturally with homeopathy, naturally with whole foods. So there's a product, so you guys like to see products. There's a product here called Advanced TUDCA. Advanced TUGCA is one tool, one product that we could use to rebalance the liver, right? It can help to clean up toxins in the liver. But I don't know if advanced TUDCA is a good product for you. So in quantum nutrition testing, we're not just saying, okay, here you go, Janice, here's your protocol, and everybody like Janice is going to get this protocol. No, we don't do that. Instead, in quantum nutrition testing, we look for the exact right cause. We look for what can help rebalance the body, and we personalize it to the person. I was talking to a patient this afternoon, and she's more of a sensitive type patient. So if you give her a little bit, her body like really overreacts. That's a sign, by the way, of a toxic liver, right? And so she's like, well, Dr. Palmer, I'm really nervous, and the bottle says I should take 2 of these 5 times a day. And I'm like, do not listen to the bottle. Instead, we're going to hold your hand and walk you through this process. And so we're actually going to find out how much of each supplement your body would do well with. And so with her, she might be on a drop of one thing. So this is one of the things she liked is BAB, right? So she might be on 1 drop, right? And that's what we start her with. Whereas other people might be able to do a whole entire dropper of this product, right? What does this product do? It can help with your immune system, right? It can help rebalance the body. It has things like sweet antiplant, wormwood, black walnut, pau de arco, astragalus, which cleans up the spleen. Your spleen is part of your immune system. Japanese knotweed, teasel roots. Teasel roots really, really good for cases with Lyme. White willow bark, boneset, devil's claw, horsetail, milk thistle. Milk thistle helps to clean out the liver. Coleus, red root, yellow dock root. So this is a product, really amazing product, has a lot of herbs in it. How do I know which one, as a practitioner, how do I know which herb to use? Do I pick what's in stock? Do I pick what's most expensive? Do I pick what's cheapest? Do I pick what I like, right? So I use my practitioner knowledge on the function of these products, on what they can do in the body, what they can rebalance in the body, what the different herb or properties the herbs have. And then based on my knowledge and based on applying quantum nutrition testing, find the exact right supplementation, not to cure, not to treat, not to diagnose, but to rebalance the body. A body imbalance does not have symptoms. A body imbalance does not have hot flashes. A body that is balanced and healthy does not have PCOS. What is PCOS? PCOS is polycystic ovarian syndrome. What does that mean? It means the ovaries are making cysts. Well, why the heck are the ovaries doing that, right? The ovaries are supposed to release an egg during ovulation. That egg is supposed to go down the fallopian tube and into the uterus. And if it meets a special friend, we'll keep this PG and child friendly. If it meets a special friend and the environment is healthy, the female is healthy, the male's contribution is healthy, then there's a chance that a baby is made, right? And so if any of those things are not balanced from the female standpoint or from the male standpoint, then conception won't happen. If a female has hormonal imbalance, she might make cysts on her ovaries, and they'll call that polycystic ovarian syndrome. To me, the treatment is not to throw hormones at the case. To me, the treatment is not to cut the cysts off the ovaries. To me, the treatment is not to remove the ovaries. To me, the treatment is not to remove the whole entire female reproductive system. That to me is not a good solution, right? And so if you've had your ovaries removed or you've had your uterus removed, I'm sorry, there's no ovary replacement. If you take your car to the mechanic and the mechanic says your brakes are bad, and they're like, okay, well, we're going to remove your brakes and send you home, you would be like, you're the worst mechanic ever, right? So if you apply some of the thought in healthcare to other industries, whether it's IT or mechanic or a carpenter or a roofer or whatever, if your roofer said, yeah, your roof's bad, and they take the roof off and they don't replace the roof, you would think they're a horrible roofer, right? So if you compare healthcare with all these other industries. And if they did what healthcare currently does as treatments, you would think they're insane. But somehow in our society, it's okay to remove the gallbladder and not replace it. It's okay to remove ovaries or uterus or testicles. Oh my gosh. There's so many men that we've encountered that are missing their testicles because they had a mass in there. Their doc wasn't sure what it is. They didn't run anything in pathology. They just removed it. Well, you don't have the problem anymore. We took off your testicles. I don't like that solution. There's so many women that we encounter. They have a mass in the breast. Mammograms have high false positives. What does that mean? It means mammogram testing is not foolproof, right? I'm not saying that mammograms have always been bad and they never have good results. I'm not saying that, but I am saying that sometimes those tests are not accurate. And so a woman will have a mass, they want to biopsy the mass, they want to remove the breast, and as prevention, they want to remove the other breast, right? That is not my ideal. My ideal is you have a problem. So it's a headache, it's a migraine, it's PCOS. It is hot flashes. It is infertility. Whatever the symptom is, whatever the imbalance is, we want to find the cause. We want to see what the heck happened. Oftentimes, it's a toxicity. It's a chemical in their environment. It's a heavy metal that they were exposed to. It could even be a parasite or a bug. Those things imbalance the body. If we can find the exact right things to rebalance the body, guess what happens? The body balances out. And now the female patient does not have PMS. She has a menstrual cycle. She has bleeding, but she doesn't have bloating. She doesn't have tender breasts. She doesn't turn into an emotional person. She doesn't have cramping. She's not bleeding to death. She sheds the uterine wall on a monthly cycle, and that's what happens. And that's how it should be. If you have anything other than that, you have imbalanced hormones. When it comes to hot flashes, it's not adding more chemicals to the equation, adding more estrogen or progesterone or estradiol or testosterone. That is not the solution. The solution, in my opinion, these are just my opinions, right? And I know that there's some amazing practitioners on here with me that would agree. Hi, Amanda. Hi, Mia. Hi, Jen. Hi, Robin. And so with someone with hot flashes, we're going to do quantum nutrition testing and determine what is the cause. Is it, sorry, ladies, that you've had exposures to chemicals, right? So if you get your nails done and you smell, I mean, come on, let's be real. You walk into the nail salon, what does that smell like? Do you know that nail techs have high percentages of cancer? Why do you think that is? What are they doing all day? They have their mask, but I'm sorry, that mask is not meant to be worn all day. And that mask does not filter out all the chemicals. They're inhaling formaldehyde. They're inhaling benzenes. They're inhaling cancer-causing chemicals. Not only are they inhaling them, they're touching them, right? They're getting that paint on their hands. And so unfortunately, those nail techs get really, really sick. When Leah was a little baby, I remember walking with her in the mall in her stroller, and I would run past, people probably thought it was crazy, but I would run past the nail salon. Why? Because I could smell the chemicals in the air, and I didn't want my newborn to smell the chemicals, right? I'm going to say something really unpopular. So, I speak the truth. So if you don't like it, I apologize. I do not believe babies should be allowed in nail salons. I think that is criminal. Why? Because you're taking a baby with a developing immune system and you're subjecting your baby to toxic fumes, right? So I'm all for moms getting pampered, right? But at what expense? Some of you guys might think that's extreme. Some of you guys may not like that I said that. I don't care. I'm telling you the truth. I don't think kids should be allowed in nail salons. Why? Same reason. You have a developing brain and your kid is inhaling all those chemicals, all those cancer-causing chemicals, all those hormone imbalancing chemicals while they're sitting with you in the nail salon. Again, not a popular opinion, but when I walk by or usually I run by a nail salon, I want to go up to the mom who probably would not appreciate my communication, but I want to go up to her and say, hey, it's really not healthy for your newborn baby to be in this nail salon. I know you want to get pampered. I know having a newborn is exhausting with being woken up, with the feeding cycle, with dirty diaper. I totally get it, but please don't let your baby be in this nail salon. I know you're trying to get pampered and you have a toddler or you have a young child, and I think they think it's cute for them to get their nails done, and maybe once in a blue moon it's okay, but it's really not healthy. I'm going to continue on my unpopular road and see how many people jump off. It's also really horrible for your elementary school student, your middle school student, your high school student to get their nails done. Why? Because you're exposing them to horrible cancer-causing chemicals. There are better nail polishes on the market that have less toxins. They still have toxins, guys, but they have less toxins. Okay, so just be aware if your teenager is moody, if your teenager is PMSy, I hate that that's even an adjective. If your teenager has horrible periods, you have to look at their toxic load. So some of you guys have gotten rid of the candles. Some of you guys have gotten rid of the plugins. Some of you guys have changed your laundry detergent. Some of you guys are cleaning with essential oils and doing a better job. Some of you guys are eating better. So all those are very, very good things. But if your teenager is having horrible cycles, you have to look at their toxic load. So sorry, don't shoot the messenger, just telling you the truth. When it comes to PCOS, I've had women that they've had IUDs, so intrauterine devices that are used for birth control in their uteruses for years, right? When you put copper in there, the body will absorb copper. The copper's there because the body doesn't want to get pregnant with a heavy metal in the uterus. So if the heavy metal keeps you from getting pregnant, then how is that healthy for the uterus? And what did you do to detox the negative effects of the IUD? I had a case last year where a friend of mine, his daughter, she's in college, started having severe bent over cramping abdominal pain. And he reached out to me. He said, Lisa, my daughter's in the hospital. I'm flying to go see her. Her kidneys are failing. They can't find out why. And so I did the quantum testing. I did the consult. I did the quantum testing. And we determined through the quantum nutrition testing that she was having a negative reaction to the IUD. The hospital staff did not want to remove the IUD because they said there's a small percentage that is the cause. Luckily, my friend's a doc and he's pretty persuasive. And I said, please, 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 I don't care what you have to do. Get them to remove the IUD. They removed the IUD. We got supplementation to detox the negative effects of the IUD. Her kidneys started to repair. The horrible pain went away. And now her kidneys are testing healthy again. And she doesn't have that pain anymore. Okay. So Janice says, I agree. The smell is awful. Jen says, nail salons give her such a headache. Yeah. Well, why do they give you headaches, Jen? Because the chemicals are awful, right? So I'm glad you don't go. Hey, Liz. Tina says, I can't walk by a nail salon or a candles bath shop, sends me into a histamine cough. Yeah. So Tina, your body is telling you these are harmful chemicals. Get the heck out of there. And your body's coughing to try to get rid of them. So absolutely. Jen says, there are non-toxic polishes. So yes, there are polishes that are much better. So I'll admit, I have a girly girl. I kind of laugh. One of my chiropractic roommates, she's a girly girl. She liked like sparkles and loved shopping and, took 20 million hours to get ready to go dancing when we were in chiropractic school. She'd blow dry her hair and make her makeup perfect and had her nails done and everything. I mean, she was like fierce, right? She was like ready to party and just had everything, all the makeup done, all the hair done, her nails done, like the sparkly glitter type person. And so it's hilarious though, because she has two boys that love football. They love sports. And I was always the more sporty roommate, right? So I was going to the gym, I was working out, I was playing club soccer, I was working with athletes. And so I like to look pretty. I like to have my hair done. I like to do all that, but I don't want to spend 2 hours on my hair. And I definitely don't want stuff. I don't like stuff on my fingernails, right? Like I like to have them like this. And oh, by the way, one of my patients gave me a sticker and gave me another sticker. Look at that. I got 2 gold stars today. Boom. And so I always thought that she would get the sparkly glittery girl, right? And then I would get the sports boys. And so I love my daughter. She is amazing. But my roommate got the sports boys and I got the sparkly glitter girl. So it's pretty interesting. Leah does love gymnastics. She doesn't love soccer. Boo. But after decades of being on sidelines from 1992, every single season to 2013, I was on sidelines, mainly soccer sidelines, but also rugby, ice hockey, Division I football. Those are the main ones for decades. That's a long, long time. So I look at it as I paid my dues in the rain, on the freezing cold ice, for ice hockey, on the sweltering summer rugby sidelines. I paid my dues. So I guess as a parent, I get to sit in air conditioning and watch my daughter's gymnastics meets. I encourage you guys, if you know someone or yourself are suffering with hot flashes, if you're suffering with PMS, if you're suffering with PCOS, if you're suffering with infertility, if you're having the worst period cramps ever, if you're puking, if you have horrible migraines, if you feel like you're bleeding to death, if your arm is tore off, get that fixed first. But if it's from a female thing, reach out to us. We love to help you here at Palmer Natural Health. We would love to find the cause of your problems. We would love to help rebalance your body using herbs, using nutrition, using carbon technology, using homeopathic. All of those tools do not have side effects. Hold your hand through the process. Maybe we have to look at what you're consuming. Maybe we have to look at what's going on in your environment. Maybe we have to look at your lifestyle. Maybe we have to look at your stress levels. We'll help you through all of that. Find the cause, handle the cause, rebalance the body, rebalance the lifestyle. And on the other end, what we've seen PMS not be a problem. We've seen diagnosis of PCOS or endometriosis or infertility fall away. We've seen women's bodies function how they were created to function, which is without symptoms, to have healthy cycles, to have healthy changes in cycles. And that's what we do. And that's what we do every day. And that's what we've done for thousands of women, whether they are in their menstrual phase of their cycles, whether they're in before they are menstruating females, or if they're in the end phase of menstruation, we help them too. If you need our help, I'm Dr. Lisa Palmer. I would love to help you. Typically, a consult in our office is $250. This month of soon to be end of January, we have a special. It's only $135. What does that include? That includes a 30-minute consultation with my staff, where we will take probably the most thorough health history you've ever received in your life. We want to know if it's a female. We want to know how your cycles are. If you've had pregnancies, we want to know how your pregnancies are. We want to know are your kids healthy? We want to know your family history, your medical history, your surgical history. We want to know what you think, right? Like, do you think these symptoms are normal? Have you had other doctors or other practitioners say it's all in your head? That's not okay. I'm not okay with that. We're going to gather all that data. We're going to take that data. We're going to do the quantum nutrition technology that enables us to look for the imbalances, that enables us to look for the causes. We're going to take that data and we're going to find the exact right supplementation, not to treat, not to cure, not to diagnose, but rebalance the body. We're going to put that together in a report, and the 135 includes that beginning process, from the consultation to the quantum nutrition testing to the report. All of that 135, that's crazy. You can kind of look at it like as one visit being 72 and the other visit being 72. But both those visits, an hour of visits is 135. If you're interested in that, you can private message the office. They're gone for the day, but feel free to private message the office. You can call the office. We would be happy to help you. Christina says, Palmer Natural Health is amazing. I feel 1,000% better after working with them. Thanks, Christina. Malka says, hi. QRT or QNT save my Friday. Okay, cool. Kendra says, I see Leah on Tuesdays. Awesome. Jen says, there's non-toxic polishes. That's right. Very cool. Christy says, I was diagnosed with PCOS. It took 10 years to get pregnant. Eating healthy and losing tons of weight and exercise is what works for me. Awesome. Awesome, Christy. So that definitely helps lowering your toxic load. And then if there's any residual symptoms, if there's anything that you need help with, we can help, right? If you have a symptom, symptoms are not normal, and we're happy to help. Awesome, guys. Well, I'm Dr. Lisa Palmer, live from Palmer Natural Health. If we can help you, we'd love to. Have a great night. Bye.